Good morning. This is Follow the Science Monday COVID-19 update. I'm Dr. Paul Juarez, Professor and Vice Chair for Research in the Department of Family and Community Medicine at Meharry Medical College. I'm also Principal Investigator of the Tennessee Community Engaged Alliance Against COVID-19, also known as Tennessee SEAL, and Site PI for HealthWorks, a HRSA-funded COVID prevention program established through a subaward with the Morehouse School of Medicine. Today is Monday, March the 6th, 2023. Nationally, new cases and hospitalizations continue to trend downward in all but a few states. Over the past 2 weeks, newly reported cases of COVID-19 are down 9% to just under 34,000 cases per day. Hospitalizations also are down 9% to a daily average of 26,411, while the test positivity rate is down 8% to 8.9%. In stark contrast, deaths are up 41% to 540 per day. But according to the CDC, the increase is likely due to delays in reporting that occurred during the holidays. There are a number of positive trends and events this week that are encouraging. First, rates of both RSV, or respiratory syncytial virus, and the flu are both declining rapidly. RSV rates are now very low, and the RSV epidemic appears to be almost over, while levels of flu transmission are now low or minimal in all but 7 states and the District of Columbia. States that are still experiencing high rates of flu transmission include New Mexico and California, as are New York City and Washington, D.C. The U.S. Centers for Disease Control and Prevention recently updated its vaccine schedule guidance to include COVID-19 shots, signaling a shift towards a more routine series. A group of FDA advisors voted last month to endorse replacing all vaccines currently on the market with a bivalent mRNA vaccine, tweaked to better neutralize Omicron variants. This is meant to simplify vaccines in general, so everyone will get the same formula, whether it's their first shot or fourth. While a final decision is yet to be made, there are still many details the FDA, the CDC, and the vaccine makers themselves must iron out. While Moderna, Pfizer, and Novavax have all announced plans to pursue trials of flu vaccines combined with their COVID shots, vaccines that offer protection against COVID-19 and influenza with a single shot will likely not be ready in time for this year, a top federal official said Wednesday. However, tweaks to update the current COVID vaccines and drugs are expected soon. In other news, the Food and Drug Administration's independent panel of advisors on Wednesday recommended GlaxoSmithKline's RSV vaccine for adults ages 60 and over, though they flagged potential safety issues over nervous system disorders that may be tied to the shot. In adults ages 65 and older, RSV causes 6,000 to 10,000 deaths and 60,000 to 160,000 hospitalizations per year, according to the CDC. The risk of hospitalization increases with age, and adults ages 70 and older are more vulnerable. The FDA is expected to make a decision on GlaxoSmithKline's RSV vaccine on May the 3rd. The panel reached a similar conclusion in a narrower 7-4 vote on Tuesday over Pfizer's application to move its RSV vaccine forward. While they recommended approval, they also raised concerns over a possible link to Guillain-Barré syndrome. As the rates continue to decline, personal decisions about which precautions to take should be based on three main factors. First, the community level of COVID. Second, personal risk. And third, risk of others you may be in contact with. For most of the country and the state of Tennessee, the community level COVID has receded to a low level, e.g., the green zone. Personal risk and risk of others is going to vary and should be considered individually in determining whether or not to continue to wear a mask. Your decision should also include whether you have been boosted or whether you were infected by the Omicron variant of COVID. Remember, the original vaccines offer little protection against Omicron. If you are neither boosted or have had Omicron, you are still at increased risk of getting COVID. While COVID is not over, and in all likelihood it is here to stay, like the flu virus, individuals now need to determine what level of risk they are willing to accept. So for now, this is Dr. Paul Juarez from the Tennessee SEAL and HealthWorks at Meharry, wishing you health and wellness. Be safe.